My name's Kathryn Donahue, and I have been an acute care RN for the past 50 years. 47 of those years have been in rural areas of California, including Hoopa, which is a Native American reservation. I worked there for 6 years for the county. I have watched for the last 50 years our broken and fragmented healthcare system get worse and worse, and understand the difference between living in the city and having problems with accessing health care and then living in a rural area like Humboldt County is. That's why I started working with CARA. And they were strong single payer supporters. I'm a strong single payer supporter. I'm a rabid patient advocate. I was able to help bring the union, the nurses union here to rural Humboldt County and St. Joseph's healthcare system, which provided nurses with a voice, which they didn't have before. And people are afraid when they work for large corporate entities. They're afraid to speak up. They're afraid to, kind of like the general public that's now waking up a little bit more because of all the dastardly things that are happening. It takes us, we the people, to push forward the agenda we want to see. A group of human beings that can speak loudly and vote. Seniors vote. So it's a powerful little group. But I enjoy working with CARA very much. So the forums are a very good educational venue to listen to people that know what's happening. Up here in Humboldt County, I first came here, the doctors that you saw in the office, they were the doctors you saw in the hospital here in rural Humboldt County. So your doctor knew you knew your family, you knew what your needs were. That went away. Slowly over time. St. Joseph's was its own entity. It wasn't involved with Providence yet. It hadn't been bought up yet, and it hadn't been congealed with to make themselves bigger. They started buying up physicians' practices here in the greater Eureka area. So St. Joseph's is the main and only hospital here. There is a smaller community hospital, Mad River Community Hospital, but it's a small little independent, and they're always struggling financially. They just closed their OB department several months back because of lack of people having babies. So that left Providence the only OB provider in this area. They're a Catholic facility. Right now, the state of California has a lawsuit. The Attorney General of California filed a lawsuit against Providence St. Joseph's for turning away a pregnant woman experiencing miscarriage, and she had twins, and they would not help her. They gave her a bucket of towels and rags and said, here, go somewhere else, because we don't do abortions here. We can hear a fetal heartbeat, so we can't help you. Go away. So this woman had to go to the Mad River Hospital, which is about a 25-minute drive away. Could have bled out on the way. She was bleeding actively. She was actively having a miscarriage, and they would not help her. So when Providence bought up St. Joseph's and all the physicians at Providence that St. Joseph's had bought up, many of the good physicians here left. They went, we don't want to be purchased by the hospital. We don't want to come under that umbrella. We like our own private practice. But I totally understand how that would be seemingly a good thing to do for a doctor because of the amount of employees they have to run their insurance department. There's a little small independent here, a community healthcare organization here called Open Door, and the CEO there once said they had to have 35 employees that just deal with insurance. And so that's a huge amount of money for a physician in private practice, and then also the insurance on themselves. So those things went away with letting the corporate entity absorb them, but then they marched to the drum of the corporate entity. There's an MD up here who has refused to be bought up because he didn't want them to be choosing the supplies he uses for his cataract surgeries. He uses superior top-of-the-line lenses that he puts into people's eyes when he does cataract surgeries. They wanted to use an inferior model, a cheaper model, something that would save them dollars. And he said, no, I don't want to be a part of you. So what happens is right now they have control of all healthcare here, all specialties in here. The Providence corporate entity has control of that. And I experienced it myself recently, and I had an issue with hearing in one of my ears. And I went to an audiologist, and the audiologist gave me a referral. That was in the middle of November. I heard that I was denied that referral in January. That's how long it took them. and the issue wasn't getting better, it was incrementally, slowly getting worse. So that's why the audiologist wouldn't touch what I was having. She said, I can't deal with this. You need to see an ENT specialist. I'll refer you. The corporate system, and I try to call them all the time too in my work, and it's like trying to swim through mud. It's like one department doesn't know what the other department is doing, so you can't get the help you need, you can't get attached to the doctor you need, you can't get attached to what you need. After it was taking too long and I couldn't get an answer, I went to my primary care physician in the open door system, and she gave me an urgent referral. I never heard back about that one. Finally, I called them and talked to somebody in some department, and they went, oh yeah, here it is. Well, we can get you in February. And I'm like, no, I need to be seen now. This is an urgent referral. And they said, well, that's the best we can do, February, sometime in February. So then that day at noon, I got in my car and I drove to Santa Rosa. Now, from here, the drive, in the winter particularly, is awful. A drive from here to Santa Rosa is 4 hours. The road is not freeway, any part of the way hardly, except at the very end. And it's dangerous in the winter. It's raining. There's hill slides that come down. I drove to Santa Rosa. I went to a different organization's emergency room, which they were wondering why I was there for, like, I couldn't hear out of my ear. That's something that I should take care of with an appointment somewhere else. But they did give me a referral because I'm a ardent, pushy person. The next day I was able to see UCSF ENT in Santa Rosa. So that's how rural people get health care here. I have a neighbor next door that goes to UCSF for her chronic major issues because she can't get the help she needs here. People travel out of this area hours on dangerous roads to get the health care they need, and most of those people, like myself, are older people. So your driving skills are questionable when you start getting older. Do you want to drive that kind of a road for 4 hours in the winter to get the health care you need? That's wrong. That shouldn't be that way. It's just important that people know that there are other options and that we can change this if we all speak up. It's on my sign for King's Day. MedicareForAll now. Those are extremely important for CARA members to find out the truth about what's happening with whatever issue the forum is about, be it your Social Security being taken away or cut or entitlement. Yeah, it's like it's being described as an entitlement program. Well, I'm sorry, I took big chunks of money out of my paycheck to be able to have this, and it works well. So CARA's Fabulous Friday forums help educate people about what's really happening, why is it happening, and what can you do to help fight back. So those are the tools that CARA gives others to be able to join the movement with all the rest of us that are pushing back against wrong, providing people with tools that they can help them work to push back about what's happening in this country.